welcome along everybody to this webinar on INSET and how to make the most out of it. Thank you for all coming along today. You will have noticed that your mics and your cameras are not working. That is intentional, and the chat as well. That's just to minimize disruptions as we talk. But if you do have any questions as we go, there is a Q&A function in Zoom. You should be able to find that button on your little toolbar, and we will try and answer as many of those questions as possible as we go through. We are recording this, and that recording will be sent out at the start of next week, so you can recap, you can share with anybody else in your team who you might want to share this with, and hopefully I am coming through loud and clear for you. But if you are having any issues, have a look at the settings on Zoom. If that doesn't work, oldest IT trick in the book, log out, back in again, that normally fixes it. And don't worry if you do have any issues. As I said, this is being recorded, so you won't miss anything. You can always watch back. So just to introduce myself to get going, my name is Catherine and I am the Safeguarding Content Lead here at The Key. I'm also joined today by two members of Oasis Community Learning, Dr Jon Needham and Matt Cannon, and I will introduce them properly in just a minute. But to begin with, I just wanted to take a few minutes of your time before we get going properly to just tell you a little bit about the Key Safeguarding and our INSET offer and what we do here, and then we will kind of open this up into a chat about safeguarding and INSET more widely. So our annual INSET pack is a adaptable PowerPoint briefing. It's two, there's a primary and a secondary version. And this covers what safeguarding is, why it's so important, what it means for school staff. I have put on this slide the changes to keeping children safe in education for 2025-26. Obviously, we are all still waiting for that. I believe the latest from the DFE is that is coming out next week. What we are going to do here at The Key is release a draft version of this INSET pack at the start of next week. We know schools want to get planning. We've had questions about where our INSET pack is this year, so that will be coming out at the start of next week. And then when keeping children safe in education does arrive, we will do a review and an updated version. So you will have something next week if you are a member of The Key, with an updated version to follow. The pack also includes information on which pupils might be more vulnerable than others, how to act in the best interests of pupils, the 4 main types of abuse and the signs to look out for there, and signs of poor mental health as well. I know that I said that it was a briefing pack, but it is more than just a kind of sit and listen to your DSL pack. It is full of scenario exercises, videos to watch, discussion topics so that staff can go and have conversations in groups around safeguarding to keep it engaging throughout. And we also include a mix and match library, which is a set of slides covering pretty much any specific form of abuse or safeguarding issue that you can think of. We wouldn't expect a school to go through all of those. You'd be there for days, but it means that you can pick the ones that are most relevant to your setting, pull those out and deliver those. That's kind of like a brief summary of our INSET pack, but we do try and update it and review it every year to make sure that it is new and interesting every year. This year, the kind of new features is a wider focus on mental health. We know this is a real crisis point, I think, in the NHS. We know the waiting lists are getting longer and longer, and schools are having to bear kind of more of that burden of looking after pupils who may be struggling with their mental health. So we have a whole section new for 2025 on how to spot those signs of poor mental health and how to support pupils who might be struggling. We have updated that mix and match section that I mentioned, with new content around AI and the safeguarding risks there, and also around toxic masculinity, the manosphere, incel culture, all those topics that adolescence in particular has brought to the fore recently. All the videos have been new and updated, so if you've ever seen any of our INSET content before, all the video content will be brand new for 2025. And for the first time, we are also using our AI tool, KeyGPT, to help out with some of the scenario exercises. So we have provided pre-written scenarios, which you can use to help train your staff on various safeguarding topics, but you can also use our KeyGPT service to really make those scenarios bespoke to you. You can tell it what sort of phase you're in, your primary or secondary, whether you're a really small school or 5 form entry, whether you're rural, urban, any of that kind of thing, and it will create a scenario that should be really bespoke to your school and your setting to make it that bit more realistic. I think I've covered a lot of this already, but just to highlight some of the real kind of benefits of our inset offering. The pack comes in a primary and secondary version. So if you are in a primary school, you're not going to be dealing with videos and scenarios about 16-year-old teenagers, and vice versa. If you're in a secondary school, it's not going to be all about 7 and 8-year-olds. Being a PowerPoint pack, it means that is fully editable and adaptable. You can just download it and use it as is, but you can also take things out, add things in, move slides around, change the pictures, anything that you want to do to make it really kind of bespoke and suitable for your setting. That mix and match section I've already mentioned means that you can kind of pick the topics that are most relevant to your school and make it kind of more bespoke in that way. And we also have an assessment that we include at the end of the inset pack, which just gives you that little bit of evidence that staff have paid attention and that they now fully understand their safeguarding responsibilities. And again, as I've already talked about, it will be completely compliant with Casey for 2025 and 26 once we've had a chance to look at it. I am going to move on to talk to Matt and John in just a second now, but just to finish off here, a little summary of what else the key safeguarding has and what we can offer. Alongside inset, we have an e-learning course which we call Safeguarding Essentials. That is basically an e-learning version of inset. It covers all the statutory annual requirements that school staff have to have around safeguarding. There's always someone who can't make it to inset because they're ill, or someone who joins later in the year, or a number of reasons why they might not be able to make it. So the Essentials e-learning means that you can just make sure everyone has had that statutory training. We have a planner and an online calendar, which can help DSLs plan training across the term and across the year, not just on that inset day. And then we have a whole bank of staff fact sheets, parent fact sheets, briefing packs in PowerPoint format, and e-learnings on a whole range of different safeguarding topics that you can use throughout the year so that you can just keep topping up that safeguarding training as you go. So let's move on now to the real reason everyone is here today, which is the focus of today's webinar. We're going to look at how to tailor that September inset day to be really bespoke to your school community. We're going to look at the importance of reinforcing that safeguarding culture from day one. Why do we do inset? Why is it so important? And also how to demonstrate and evidence the impact of your training. We know Ofsted are going to be looking at this in future inspections, so we'll touch on that as well. And as I said, I'm very pleased to be joined by Dr. Jon Needham and Matt Cannon, both from Oasis Community Learning. John is the National Director of Safeguarding and Mental Health. He leads on the Trust's strategic approach to safeguarding, having previously worked as an advisor for the World Health Organization and also as the Education Safeguarding Advisor for a large local authority. And then Matt is the Acting National Safeguarding Lead at Oasis. He has that very operational approach to safeguarding across the Trust. He's in and out of schools all day, every day, implementing new systems and processes to improve safeguarding. Delighted to have them both with us. I'm going to stop screen sharing now so you can actually see us all. Hopefully we now all appear on your screen. And I'm just going to kick off by asking you both a question, which is that, well, inset means a lot of different things to different people. And I know that there are some schools out there who do have the luxury of spending all day in September on this, but realistically, the vast majority are looking at an hour or two max if they're lucky. So for those schools, which I think are the majority of schools, how can they really plan what they need to prioritize when they're really pushed for time on that inset day in September?
I think you're absolutely right. Most schools aren't going to get a whole day to do safeguarding. And I think that the first and important message is we've got to avoid a tick box approach. We can't do safeguarding in September and then focus on pedagogy or phonics or whatever it might be for the rest of the year. What we've got to do is make sure we cover the basics, the essentials at the inset day, and then throughout the year, bring in those contextual issues that are really relevant to the school and the community and the kids. So it's planning your safeguarding training as a year approach or a 2-year approach, not just saying, well, let's do safeguarding on the 1st of September and then we've done it for the year. So what we look at is exactly that I've just identified. We look at the key issues, what's really important to cover, what are the key messages, and the challenge. Certainly the challenge for me strategically is I want to talk far too much and I want to put far too much detail in as if I'm training deputy DSLs and DSLs. And Matt will go through this in a bit. What Matt does is say, actually, no, what we need to focus on is our school staff, our support staff, and our teachers who need to know what to look for and who to report it to and what might happen next. They don't need to know about making a good quality referral. They don't need to know about the impact and evaluation of an intervention by social care or a third-party organisation. What they need to do is recognise the basics and who to go and report to. And the challenge there is recognise the basics at different staffing levels. So the training that we give our cleaners and our lunchtime supervisors will be different to the training that we give to our pastoral teams and our support staff, which will be different to our teachers. You know, so does a science teacher need to know about private fostering? You know, we would argue no. It's your admin team and your pastoral support team that need to recognise when private fostering is in place and what they do about it. So it's that adapting, but tailoring it to the contextual issues that the school face. I don't know if you want to add anything, Matt.
Yeah, I think another key question that is often asked of schools is, you know, tell us about your culture of safeguarding or your culture of vigilance. So take that time in INSET and throughout safeguarding training to really work with your colleagues to define what that actually means to you in your schools. You know, how does your culture of safeguarding align with your ethos and values? So at Oasis, what we're looking at doing now is really very deliberately defining safeguarding through the lens of our 9 habits that we use and we use in all areas of our work. So, for example, what does it mean in safeguarding for us to be hopeful, you know, being hopeful that families can change and really working on defining that so everyone knows what they're working towards. And just to really stress that point that John made, who needs to know what? So who needs to know about site security issues and where that needs to go? And as a DSL, how are you ensuring that you are involved in those conversations with those key members of staff and that they are being supported to access the most appropriate training for them and just meeting their needs? So, for example, does INSET training need to be everybody in the hall all together, including midday supervisors, including site staff? Or are we better off doing a 30-minute session with site staff at another time where we can be really specific about what they need to know?
My understanding about the new Ofsted framework is the inspectors aren't going to be so much interested in what training have you delivered. They're not going to want to see attendance lists and everybody signed in. What they're going to want, well, although they are going to ask about those staff that weren't there on your inset day or the new starters in at Christmas or the new starters at Easter, what they're going to want to know is what difference has that made to your team's practice. So rather than a sign-in list, a thing that says what I've learned most from this session or the 3 things that I'm going to change about my practice because I heard ... that's going to really show the culture of safeguarding rather than compliance, rather than a tick box approach.
Brilliant. Yeah, agree with all of that. Thank you. I think it was interesting what you were saying, Matt, in particular about really kind of tailoring it to your schools, like the culture, your 9 points. I think that's something that we've really tried with our inset pack, just to make sure that it is editable and tailorable. And I think that's a really key thing when you're pressed for time, what matters most in your school. We've touched on this already a bit, but and I think I mentioned it in my introduction as well, that you can never get everybody together at the same time on the same day, no matter how hard you try. There's always reasons why some people can't make it. What would your top tips be for, you know, making sure that everybody is trained, even if they can't make it on that all important day one?
Yeah, really hard, isn't it, to make sure everyone's in the same room at the same time, and you know, we can't help sickness and things like that. I think the number one golden rule is that really critical information, we need to make sure we follow up with those members of staff to make sure they receive that, and also that they're receiving it in a way that they can access it. Certainly we have members of staff that perhaps struggle with literacy skills or IT skills, so making sure that you are, as a DSL, are making sure that it's accessible to them is really important. And you know, maximize any opportunities there might be for that, and work with them to be available at a time that suits them. I know schools are really busy places, and we don't want to take key staff away from duties perhaps, or from their teaching, so there requires a level of flexibility. I think crucially though, safeguarding needs to be that golden thread running through all training. So regardless of if they've missed inset, actually there is a thread of safeguarding running through everything. I strongly believe there's an opportunity to talk about safeguarding when we're doing our discussion about behaviour. You know, really promoting that professional curiosity around behaviour and why is that child behaving in that way, links back to safeguarding. And similarly with SEN, we know that some SEN presentations are very similar to trauma presentations. So actually, again, really promoting that level of curiosity in staff around what is going on for that child. That is safeguarding. Being curious about a child's lived experience is really crucial. John?
I'd also say it's making the training relevant to the right people. So if we're going to train our cleaners, and they're a key part, the cleaners see things in our schools that the staff don't necessarily see, but it's making the training relevant. So a good scenario for a cleaner would be, what if you're cleaning the toilets and you see some graffiti on the wall that raises concerns? Do they just scrub it off the wall because their job is to clean it? Or do they think, well, I need to report that to the DSL? So it's making that scenario fit. And certainly in the adaptable versions that the Key produce, it's trying to, it's saying to our staff, well, the national child protection rates might be 42 per 10,000, but in our school, we've got 10 cases of child protection. Yeah. There are 3 in year 3 or 3 in year 8. And this is why those children are behaving in that way. So it makes teachers and it makes support staff think, oh, no, I understand. It's like it's the beginnings of that trauma response. If I understand the history and the story that child's going through, then my teaching or my support will be different because I'm being considerate and I'm being responsive to the trauma that kid's gone through. I think another group that we miss out on is supply staff, particularly supply staff who come in just for one day. How do they know what our approach to safeguarding is? Do we give them a briefing as part of that? Well, you're in year 6 today. Watch out for little Bobby because he's a 1. That's not a safeguarding briefing. It's, if you're concerned, go and speak to Catherine because she's the DSL. These are the kind of things we look out for. Particularly, I mean, I know it's not strictly safeguarding, but how do supply staff know who are the kids with allergies or the kids who've got EpiPens or autoadrenaline injectors? How do they know that child's diabetic and therefore they're not just messing around? Maybe they're hypo and their behavior is because of a medical issue. And it's those kind of briefings that we need to give as part of that overall safeguarding. Ultimately, it's the head teacher or the principal that's responsible for safeguarding in a school, and they're the ones that are accountable. They'll be ones that go to the coroner's court and explain why we didn't tell supply staff such and such. And the principal delegate that responsibility to the DSL. So if you're the DSL and your principal says, well, you've got half an hour, cover everything, and that's it for this year, it's about saying back to the principal, well, actually, it's a delegated responsibility and I'm not able to fulfill that responsibility. Therefore, I'll give you ultimately you need to carry the can on this one. And as soon as you start to say it's about accountability and responsibility, you can start to make that argument equally. So you can't ask for a whole day when you've got to do phonics and you've got to do everything else that needs to be done in that inset and mop up people's tears because they don't want to be back at school because they've had a lovely 6 weeks off. But it's making that training applicable to the people listening to it, I would say, is the key issue.
Yeah, I think that scenario point in particular, it's something, we obviously get a lot of feedback from schools working at the key, and we hear that a lot about wanting scenarios that are really, really bespoke and specific to certain roles and certain schools. So I think, yeah, anything that can be done to really hone in on particular roles or particular school types, it's a great idea. As you know, part of the title of this webinar, we've kind of flagged that safeguarding isn't just INSET. You can't just do it on the first day of September and tick it off for the year. Any kind of ideas or top tips again on how schools can really think about that more strategic or like long-term approach on a more like termly or yearly level than just thinking about INSET in September?
So safeguarding can't be that tick box exercise in September. And like John mentioned earlier, we encourage all of our academies to have that 1 or 2 year training plan so that they're really clear how they're covering all their topics, and not just particular safeguarding topics, but also practice issues, like, for example, how to make a good log on the system that you record safeguarding concerns on, so that we're constantly revisiting that training. We also really stress to our staff, because we know that time is really precious, that training doesn't have to be everyone in the hall DSL stood up at the front. It can be like the keys fact sheets or videos that are sent out. It could be that you found a really good news article that discusses a local issue really well, and actually that's a really good resource to send out to raise awareness of a particular issue impacting your community. So what we say is training can come in many different shapes and sizes and formats, but it's really important that the DSL and principal together really consider what is important, what needs to be covered as a priority, and actually who needs to have what training. And planning that out very deliberately is really important, so that we cover everything we need to do, and we're not just being reactive because there's been 3 cases of harmful sexual behaviour in year 3.
The key issue, though, is Ofsted will want to know the impact of that training. So document what you do, send it out, but also how are you going to get the feedback from staff? And I think one of the things that DSLs can look at is the numbers of disclosures or reports that are made on your reporting system. And at its most basic, you could say, well, actually, we're at the end of term 1. Matthew, you've not made any referrals on CPOMs, my concern, or whatever it will be. Does that mean that you didn't quite understand the safeguarding training that we've had? Are you missing things because you're not putting anything on where everybody else in year 3 has put on 3 or 4 or 5 disclosures? So you're missing a trick. Equally so, you could say, Matthew, you've put on 30 disclosures in this last week and everybody else has put 2 on. Are your thresholds too high? And one of the things we need to be thinking about is we talk about safeguarding being everybody's responsibility, but often it's dumped on the DSL's lap. So what we need to think about is how do we empower our classroom staff, our support staff, and our teachers to pick up the very low-level safeguarding issues before they turn into a big issue. And I'll give you an example. It's the middle of the winter and little Catherine comes in without a coat on. She's freezing cold. Is that a safeguarding issue, or is that something that the classroom teacher needs to pick up with mum at pickup time and say, Catherine didn't have a coat today, we're a bit concerned, is there anything? And it might lead into, well, we can't afford a coat, or she's outgrown it, or it was stolen, or well, what can we do as a school to help you with that? It turns into a neglect issue if by day 3, Catherine's still coming in without a coat on. I've tried to address this. I'm now going to take it to the DSL, who will pick it up with a sort of more neglect focus on those kind of issues. But if safeguarding is everybody's responsibility, we all have to take our part in that. So, and that's what an inspector will be taught. When an inspection happens, they're going to walk around the school and they're going to say to somebody, anybody, it could be the teacher, it could be the cleaner, it could be the secretary, what do you understand about sexually harmful behaviour in your area? And the expectation would be that member of staff can answer. Now, it might be I don't know a great deal, but I know if I was worried, I'd go and speak to the DSL. That's a good answer, because it shows that the culture of safeguarding, everybody's taking that responsibility. The worst would be if somebody just shrugged and said, well, I don't know. What does that say about the training? What does that say about INSET's failed? If a member of staff says, well, I don't know, I don't know. It's just lost completely.
And I think leading on from that point, John mentioned earlier about how you check for understanding after training sessions, asking members of staff to write down the 3 points they've learned, or how they're going to change their practice. It's really important that if you're collecting that information, and that as a DSL team, you are reviewing that, because there's a great opportunity there to pick up with members of staff that perhaps it hasn't just quite clicked with, because it is important we follow that up and just make sure that everyone is really understanding those really important topics.
Another example where you could use the data behind safeguarding to lead your safeguarding training is filtering and monitoring. We've all got to have systems in place. We're all picking up issues that have been blocked. And actually, the DSL and whoever's monitoring, whoever does the e-safety, it's not just saying, well, we've had 700 blocks this month, therefore we need to tighten up our e-safety training, or we need to tighten up our filtering system, but it's looking what those blocks are. And it might be that we pick up in year 8, there's a lot of online gambling sites that have been blocked. The DSL can then say to the curriculum development team, well, actually, we need to build something into our PHSE curriculum around gambling, or we need to drop down an assembly on the dangers of online gambling, because that shows that we're responding to our filtering and monitoring, not just blocking something. And then the other thing you could do is look at, see what, if you've had 70 hits on pornography and you're about to do the puberty talk with year 6, it's building that in, it's making your training responsive so that our teaching delivers what kids want to learn rather than delivering what we've always delivered. Because if filtering's not, if people are searching for something, then our curriculum's not quite meeting that need. So it's using our filtering and monitoring and the data that's produced around safeguarding to actually build it into our curriculum, and not just in the sort of really the obvious subjects, but actually we could be talking about racism throughout the year, not just in Black History Month, or we could be using LGBTQ plus role models throughout our curriculum, not just in Pride Month. So it's weaving the safeguarding data throughout the whole curriculum. And that's one of the things the inspectors will ask, because in KICSI 24, and I'm sure it'll be in KICSI 25 or Casey, I know that's what you call it, but however you pronounce it, it's going to say the DSL is responsible for the safeguarding curriculum. That's not to deliver it, but that's to say to our curriculum team, we need to cover this issue because the safeguarding data that's coming out of wherever says ...
Absolutely. And I think that goes back as well to what you were saying, Matt, about not all training has to be DSL stood at the front of the room. It can be much smaller. I mean, it's sharing it in the curriculum, but also sharing it with your staff. I think of the DSL I spoke to who called it nuggets, which has really stuck with me, like safeguarding nuggets. Just pop a line or two in a weekly newsletter to staff or something with those kind of points which you've spotted from your filtering and monitoring, or from whatever way you've spotted it. I think that's a really good point. You've kind of already started down this route, John, but I'm going to ask you a bit more about the new Ofsted framework. We know that we think it's going to be less of a focus on kind of what training is happening, but more about the impact that it is having. I know you've already started on this, but is there any other advice you can give to schools around kind of really making sure that that training is impactful and is having an effect?
Yeah, so it's the culture that's going to be really interesting. And one of the things I think that the new inspection framework is going to look at is particularly how governing bodies and how leadership team are convinced that the safeguarding training is effective. So as DSLs, we need to think about our governing bodies or our trustees, and how are we updating them on what the contextual issues are, so that they can challenge the school around the effectiveness of our provision. And certainly, I said earlier on that the head teacher or the principal is ultimately accountable for safeguarding. So are they aware of the referral rates, or are they aware of the conversion rate between referral into social care and conversion to assessment or conversion to early help? Because they're the ones that will be challenged by the inspectors. And the last thing we would want is a principal to say, well, I just hand everything over to Matthew and I don't know what else goes on. It looks that the culture there shows that there's a break. So it's picking up those elements as well as throughout the year. But the other thing around the culture of safeguarding is to involve the kids in that safeguarding training. We were Matthew and I were in a school earlier on this week, and really good approach to safeguarding. We met with the pupils. The pupils were clear on who they would talk to, but we said, tell me about the safeguarding team. And they started to get a little bit hazy. They could talk about adults that they trusted and how they chose that particularly trusted adult. But I looked at the wall, and they've got a safeguarding poster on the wall that was on an A4 poster, and the font was like size 8 font, and it had been slightly crumpled, and it just looked messy. And I said, well, how about that poster? And the kids said, well, I don't think I've ever seen that before. So they knew who to go to, but they didn't know it wasn't embedded in the culture. And so one of the things we suggested was that you get each child in a class to draw their own safeguarding poster, so that they know that you've given them the key message, you've told them who the people to talk to, you've told them how you can go and talk to them. So they design their poster, then the whole class votes on a winning poster. So the whole class has been involved in that discussion, and then you blow that one up to size A3 and you laminate it and you put it up. So the classroom owns their safeguarding referral route. And if each class did that in a school, then you might have 30 different posters, but every child knows who to go and speak to. So the children are involved in the development of, so you're giving them agency around disclosure. And you can have that same discussion with parents. You know, we just assume parents will read the safeguarding process on the website, but we all know that they're only going to do that when they've got a complaint, so they can copy and paste it into their complaint. So how do we tell parents, if you're worried about your kid, come and talk to us. Don't let it get to the point where you want to make a complaint, because that's safeguarding. If you're worried about your kid, come and talk to us. But we need to develop our parents' links into safeguarding as well, because it's about the community.
And I think what I would add is that we just need to test these processes, and we know that Ofsted do that as well. When they come in and do parent view, and when they come and speak with children. So as DSL and principal, or pastoral staff, take the opportunity to meet with children and meet with parents, make sure they truly understand and just hear their feedback, and incorporate that into your plans about how you are developing safeguarding in your setting.
When we spoke previously about this, John, I think you mentioned something about like a map which children did, which I thought was such a good idea. Yeah, so, share that.
Yeah, that was another idea about getting kids to engage in and where they feel safe in school. So one idea that we've tried in some of our schools is you give them a map of the school, and you say either in tutor time or in group time, you say draw on the map or give them sticky labels. Put a sticky label on the map of the school where you feel the least safe, and it might be the corner of a playground, or it might be the stairwell round the corner, and then if you can identify where kids feel unsafe, it allows you then to rearrange your duty points and your lunchtime supervisors so that they then stand in that corner, so you sort that issue out. And then if you repeat that next term, and this time it's around the back of the bike sheds, then you move your duty points around again. But it shows that, and when an inspector comes around and talks about safety, you just throw them 300 maps of the school and show them the work you've been doing. But what it does is it shows kids that you care, but it also shows it's also responsive. One of the things that we're keen on is the young people's voice. We talk about pupil voice, and the sort of "you said we did" poster is a really good way of addressing that student feedback, but it's got to be in a place where the students are. So it's pointless it being in the staff room. It makes more sense to have "you said we did" in the main corridor, so that when kids make a comment, it might be your prefects, or it might be a student council, or it might just be, you might have a worry box that you can demonstrate that you've taken action. And all of that fits into that culture of safeguarding that inspectors will be looking for.
Oh, yeah, I'm a school governor as well, and when we do kind of like learning walks, I've definitely seen it before, where you ask what they might do if they don't feel safe, and they will all say exactly the same thing, which is speak to a trusted adult. And I often question whether, do they really understand what that is, or have they just learned that is the answer to that question? So I think your ideas there would really benefit.
One of my schools gets kids to do a handprint, and in each of the fingers they write the name of the trusted adult. And in that exercise, they make sure that at least 2 of those fingers are school staff. So it might be my parents, and it might be my auntie, and it might be my vicar, or my what do you call it, my imam. But 2 of them have to be the school staff. And if they're struggling with that, you can say, well, of course, Mr. Cannon's the DSL, isn't he? He's the safeguarding lead. Would he be a safe person? So you've already started to dig that. You've started to embed that safe person concept into their head.
We've got about 10 minutes left, I think, so I have one more question, and then we will save the rest of the time for Q&A. I like to always ask this question on any kind of safeguarding call. What do you think are going to be the big safeguarding concerns or issues going into next year? Obviously, we don't have Kixie, however you say it, yet to see what they think is going to be big next year. But from your expertise, where do you think we're going to be focusing?
I think what's crucial is we need to look ahead, see what's on the horizon. We're anticipating a child poverty strategy from the government, and also a violence against women and girls strategy. We know that we're going to have the police and crime bill, which is likely going to have some implications for schools, and also the child wellbeing bill. So there is potentially a lot on the horizon that is going to impact us. I think the two areas that you've identified and developed your resources for around AI is really important. We know the National Crime Agency have just published some further guidance on how settings can respond to such concerns too. And also the element of masculinity and misogyny that goes along with that will be two really key issues. The third one that I think, which will be a really significant issue going forward, is the idea of partnership and collaboration. We know that there is a lot of speak around education becoming a statutory safeguarding partner. We know there is lots of pilots in various local authorities around what things might look like in the future. So crucially, it's about being on the forefront and building those links and connections, but also not just with partner agencies, not just with social care and police, but with your parents. Parents are absolutely crucial in keeping children safe, and we have to work in partnership and collaborate with them. We have to have them on board. We already know that if we work with families and we work with their consent, we get better outcomes. So that early intervention needs to start much sooner and be embedded into our universal offer. So when we're getting parents in for parents' evening, can we have a safeguarding stand there where we're talking about the latest topics? How are we equipping parents to keep their child safe? I think sometimes we get quite frustrated as a sector that perhaps we're doing more and more that we would expect parents to do, but actually how are we empowering and equipping our parents to be able to do those things? For example, if you weren't in the education sector, would you know a lot about nudifying software, AI software? You probably wouldn't. And I'll put my hands up that I probably don't know a great deal about it now because I'm not a tech expert. But there are resources out there that we can share with your parents. I know the Key have got lots of those types of resources. So I think those, partnership, collaboration, and look to the horizon and see what's coming around the corner are going to be two really big things for us going forward.
I can't really add anything onto that other than the bit about the parents I think is crucial. Kixie 2 years ago made the DSLs responsible for online safety at home and in school. Well, how can we be responsible for online safety? What we've got to do is educate our parents and support our parents in that parenting role. If I had my way, I'd call it keeping children safer in education, because I don't think we can guarantee safety because we only work from 9 till 3. Although everybody's in school till 7, but you know what I mean? It's parents are the ones that we need to empower because, they hold parental responsibility. We need to be supporting parents to pick up those additional roles. So a ban of phones in schools between 9 and 3 isn't going to have a major impact on a child's life. Supporting parents to support their kids around safer usage of technology is the key issue. So, everything we do has to lead to parents having the agency to look after their kids more effectively and safer.
Yeah, absolutely. We hear it all the time in our user research that you can do everything that you possibly can in schools, but if you're not doing the same thing with the parents, it's only half of, or not even half of their lives, is it, that they're in school? And
to be honest with you, that needs to be in some of the published reports as well, because all the reports put the responsibility on agencies to do this, that, and the other. Very, very rarely does it say, and parents need to pick up their responsibilities at home as well. So it needs to be reflected, not just in our practice, but in the guidance and the statutory stuff that's published.
Thank you so much to both of you. We've got about 5 minutes left, so I'm just going to see now. I can't see any questions in the Q&A box, but I'm hopeful that maybe 1 or 2 might trickle in. Let's see. While we are waiting and seeing whether there are any questions, I think I'll just flag that when this webinar ends in a minute, you will get sent a survey. So one will pop up immediately. And if for whatever reason that doesn't work, Zoom being Zoom, it will come to you via email as well. And we'd really appreciate it if people who have attended can just take 2 minutes to fill in that survey, tell us what you did and didn't like about this, and then it helps us plan future webinars. Any questions coming in? No, maybe we've been so comprehensive that we've not got any questions. Oh, no, that's right. That's something different that's just popped up. All good. Well, fabulous. Well, if there are absolutely no questions, I mean, normally I would ask one, but I've been asking you questions for the last half an hour. Okay, there's a question around kind of parent engagement. I know we've talked about it a bit already, but I think you did when we briefly talked before, John, you had some ideas about kind of like parent surgeries.
I think the mistake is to say, well, I'm going to put on a session on e-safety. I'm going to invite parents into the training session, because we've all done it and we've all spent ages preparing the materials, and then 2 people turn up, one of whom's an IT technician in the real job, and one of them thought they were coming to a meeting about something else. So we've got to do things differently. So like Matt said, if we've got a parents' evening, could we do 5 minutes on how to secure your devices? And then we'll talk about parents' evening. Or on a school trip, could we talk about how we're going to keep your children safe online and then do the stuff about the school trip? Could we train those interested parents to become champions in the playground? So, you know, I think a lot of the issues is sometimes parents don't know how to put on parental locks or how to do virus scanning or whatever it might be. Could we train those interested parents to be the champions in the playground who could say, well, you don't have to admit it to the teacher, but I'll show you how to do it? Could we produce 1-page guidance on how to do something, rather than have to admit your ignorance to the school? So I think we need to change the way we do stuff rather than just expecting people to turn up.
And I would just build on that. I think the point about changing how we do things is really important. Many of our communities are really diverse, you know, probably many different spoken languages and cultural needs. You know, how are we as a school responding to that? Do we need to get local community leaders on board for these sessions too, particularly if it's a culturally sensitive topic? If it is that our parents, there's a predominantly a language spoken that is not the DSL's first language, actually, how do we make sure that sessions are accessible? Do we need to have a translator? Is there a member of staff or someone in the community that can support in delivering that? And it's about how we reach out rather than expecting them to come to us.
There's technological ways to do that. You know, there's a real link between safeguarding and attendance, and I think that's going to be one of the big issues in KICSI 25. But when we go and do home visits and we talk about the importance for education, and we're talking to somebody who speaks their community language, then we've missed that opportunity. So we need to think about, like Matt says, in different languages, different ways of doing things. Otherwise, we're just doing what we've always done, and we've already shown that that doesn't work because our attendance stats aren't rising nationally, are they?
A few more questions have come in as you've been chatting, so I'll try and get to them as quickly as possible. There's one here about what is the best approach to capture the impact of training with staff? How can you kind of have a log, I guess, or how do you capture that impact?
So I think there's a couple of ways of doing that. I think that post-session feedback, how have they found the session, what is their learning from the session, is really good. I think the other thing to do is when you are beginning to plan your CPD calendar, getting that staff voice. You know, what do they want? What have they found really useful? What is their preferred delivery style? If they say that they've really enjoyed actually having videos, 3-minute videos to watch, you know, how are we adapting our CPD to meet the needs of staff would be really beneficial for evidencing that we are responding to the needs of our staff. but ultimately looking at your safeguarding data that you're extracting too. You know, if you're doing training on domestic abuse and suddenly you see a spike in staff reporting concerns about domestic abuse, well, actually, that's really good evidence that your training has been impactful and the staff have taken something away from it.
And vary up your methodology. So some of it will just be an attendance list for a training session. I mean, something like for those of the schools that use CPOMs as a process, CPOM's library allows you to send out information, and when you can check then who's read that information, you can have a response button. I've read and I've understood it, so you can start to produce lists. We've introduced a CPD booklet that for each of those safeguarding sessions, there's a what 3 points have I learnt. And what we say when we roll this out is it's not meant to be you now take half an hour to fill your book in. It's now take 2 minutes to write those key messages that you've heard. That has more impact than having a certificate that says I've attended some training about whatever the subject might be. All that says was I've got a piece of paper that says I've attended a training session. I might have been asleep or I might have been talking to my mate during that session. That what 3 things have I learnt, or what 3 things am I going to change in my practice, embeds that learning, and it shows the culture of safeguarding. So mix it up a bit from attendance lists to read and understood to 3 points of learning kind of thing. And as you know, those of you who are trained, I'm not a trained teacher, but we all know that people learn in different styles. So don't just deliver a boring face-to-face lecture. Like Matt says, use videos, use games, use quizzes, personalize it. So they think, well, that could have been my class that could have been my kid in year 10. Now I understand why he behaved like that. Personalize.
Yeah. I am aware that we are out of time, but there are still questions coming in. So if anyone does need to leave, we completely understand, but we will just, I think there's only like 2 left, so we will just try and quickly get through them. Dina has not much a question, but just added something here, that some of the schools that they're with use an Outlook calendar that all staff can input into for incidental safeguarding opportunities as a quick way to capture. So that's just like an idea for people there.
But it's tracking that as a DSL. It's tracking that to make sure that everybody's accessing that, and it's not just the person in year 3 who's not done any training. It's going up to them and saying, actually, everybody else is doing it. Why aren't you? So it's having the opportunity there, but as DSLs, it's making sure that everybody's picking up that opportunity. That's what you'll be asked for in an inspection.
I've got one from Rebecca here. In terms of trust level, do you use pupil voice to inform trust strategies, or is that only done at school level?
For us, this is a developing field. So all of our schools do pupil voice, and all of our schools do parent voice ready for Ofsted. But we've just introduced trust-wide pupil voice. We introduced it at the beginning of this half term. So we will be using that data to lead on our suggested CPD profiles, but it's brand new to us. So the intention is to use a whole student voice. The benefit of having a trust questionnaire is that we can adjust the questions to meet some of the contextual issues or the horizon issues that we see coming on the future.
And last one is from Chris. When does attendance genuinely become a safeguarding issue? Some issues with social care and not touching cases where there's concerns about neglect.
I think that's a really difficult question, and I don't think there's a binary answer to that. I think what is really important is that we are challenging our local safeguarding children partnerships where they're not adopting a definition of education neglect, and that we are asking as a sector that is incorporated into the local threshold guidance, and hopefully there are avenues within your local areas for you to feed that back. But also on a practice level, I think really strong chronologies is really important, and something that I've been asking our academies to do is rather than just recording that a home visit's been completed, that we're really digging in. We're saying what the child presentation was like, the parent presentation. We're commenting on the home conditions, and we're trying to gather as much information as possible so that there is a really clear evidence base for completing that referral. And I think also really importantly, and I was asked this at an inspection, So you've made a referral and they've said no. Why didn't you challenge it? And I think that's a really good question, because if we believe that much that that child is in need of that support, why are we accepting a no? It is just as much on social care to explain and justify their position as to why they're not accepting the referral, as it is for us to evidence why we believe they need social care intervention. So I guess there's a couple of elements there. Challenge your local authority around it. Don't accept no as an answer if you truly believe they need social care intervention, and make sure your records are building a really good evidence base.
I'll add on to that, because I'll be controversial. Education is education's responsibility. So we need to demonstrate everything that we've done to try and engage that kid back into work, including part-time timetables and reintroducing to full-time and all those kind of things. But what we need to be able to say is, but when they're not in school, we're concerned because they're down the park or they're in a house where there's no parental supervision. And it's that bit that's social's responsibility, not the school bit. So we need to say we will do the education bits to the best of our abilities, but we've got no control over outside of school hours, and therefore that's what we need social, whether it's an early help worker, families first worker, or a whether it gets to the point where it needs a section 17 or 47 investigation. But we will do the education bit. We need you to do the social bit.
Brilliant, thank you. And that was the last question, and we are a few minutes over time, so I think we will leave it there. Thank you so much to both of you for taking the time. I think that's been really informative and hopefully helpful for everybody on the call. As I've mentioned, there's a survey to fill out after this. The recording will be coming around in an email. And if anyone on this call is free at 4:30 next Wednesday, we are doing another webinar. This one is on all of the features of the key and what the key can do for you. So if you fancy that, there'll be a sign up link in that same email as well. And we will leave it there. Thank you, everybody. Thank you, John and Matt. And have a good evening. Goodbye.
Thanks, everyone.
Bye.